for what they're about to experience. These are incredibly powerful, mind-altering drugs, and some people have trouble handling that. And so if you prepare people, then you can help them to avoid having what used to be called a bad trip. We help them to prepare for their intentions. What do they hope to get out of this? Then they come in for their dosing day. They spend the full 8 hours with us. There's always 2 facilitators that are with them in the room while they're taking their psilocybin. They're there just to make sure that people feel comforted by the presence of somebody else if they're having a challenging experience, if the psychedelic drug brings up traumatic memories or things like that.
And while the participants are undergoing this so-called trip, they wear a blindfold or an eye mask. They also take a pill. Psilocybin is derived from a kind of mushroom, and this is a lot of self-exploration in many ways. Can you recount what patients in these studies have said the experience is like?
Yeah, this is a fairly high dose of psilocybin, so people will have a strong response to the medication. The various things that people feel are something called ego dissolution. That is, the border between you and the rest of the world dissolves a little bit, and you begin to feel like you are more a part of nature and the universe and not as distinct. You might respond with visual hallucinations, auditory hallucinations, and what we encourage the patients to do is direct their attention inward. So we provide an eye shade. We are playing soft music, largely without lyrics, mostly instrumental, so as not to intrude on the patient's ability to focus on their feelings. These medications have to have the ability to allow you to face challenging experiences that you've had earlier in your life, and those can seem very realistic. You may feel like you're having an encounter, that you're reliving some conversation that you had or some event that occurred earlier in your life. That is presumed to be part of the healing process. Part of what makes you feel better on the other side is your ability to confront something that you may have been avoiding. But it can be very challenging for the patients. If you've got some traumatic event in your childhood, staring that face to face can be very difficult. I want to point out the boundary between a challenging experience, facing a trauma, and a bad trip where it's not doing you any good at all. In fact, it could be damaging you.
And you do